As I'm taping this right now, there is a massive wildfire burning about 70 miles north of here in Ventura County. As of just a couple minutes ago, it had already burned over 50,000 acres and over 30,000 homes have been evacuated. I'm sure by the time you see this, those numbers are going to go up significantly. Here in Los Angeles, there's soot flying around all over the place, and there's a dark gray haze and a deep smell of smoke. I just walked my dog for literally 2 minutes, and not only couldn't I see all the way down to the end of the block because of the smoke, but my clothes absolutely stink right now. We just finished up our interview for this week with Jessica Flanigan from the University of Richmond, and although we never edit for content on this show, we actually are probably going to edit out a couple coughs and hacks as the air quality in the studio is pretty bad right now. Ironically, our interview had a lot to do with public health, so stay tuned for that. I don't mention any of this for pity for me dealing with some soot and some smoke today, as much as how things can be put into perspective pretty quickly. Of course, a quick perusal of Twitter allowed me to see people saying California is burning because of its leftist sins, and others saying it's burning because of global warming and lack of regulation. Yes, even natural disasters are political these days. As we're in the midst of the holiday season, perhaps let's try to be a little less political as we run out 2017. The spirit of the season is about joy and giving, not fighting and bickering, yet unfortunately it seems we do the latter two a lot more often than the former two these days. The people being affected far worse than me by these fires are on the left and on the right. They're pro-choice and they're pro-life. They're black and they're white and they're Christian and they're atheist. It's not just good ideas that can bring us together, but also bad events, so let's not make them worse with an extra helping of hate. I'm going to try to be a little less partisan, a little more open, and a little less political as the year comes to an end. I think I do a pretty decent job of being fair and open-minded in general, but a touch more of those traits never hurt, especially around holiday time. Politics is important, but it isn't more important than finding some room in your life to be grateful, to be decent, and to be tolerant. My challenge, if you're up for it, is to perhaps try being a little more tolerant yourself in the spirit of the season. I know that your intellectual opponents and sometimes even friends and family members often won't make it easy, but I think it'll be worth the effort as we wind down this crazy year. Whether we like it or not, we're in this thing together, and perhaps putting out some brush fires now will spare us from some major fires in the future. We're continuing our partnership with Learn Liberty this week, and joining me today is an assistant professor of philosophy, politics, economics, and law at the Jefferson School of Leadership Studies at the University of Richmond. Jessica Flanigan, welcome to the Rubin Report.
Hi.
How are you?
Doing well. Yeah, let's learn some liberty.
Let's learn some liberty. It's kind of funny, we're going to talk about a whole slew of things here, but medical ethics are involved. And as we are taping this, at this very moment, there is a massive wildfire about 45 minutes from here. The smoke and soot outside right now, that's even seeping into the studio at the moment. I was just sneezing right before we started. I can feel it in my lungs. Are you feeling it at all?
Yeah, no, it's pretty intense out there.
Yeah, you were going to walk here from the hotel, which is only about 4 blocks away, and you were like,
no, yeah, I bailed.
Yeah. So there's something about medical ethics or something with smoke and fire, and, or as you said right before we started, maybe that's more environmental ethics, perhaps?
Yeah, I don't know what it is out there, but yeah, it's a lot.
It's a lot. All right, so we're going to talk all sorts of things, but let's start with medical ethics.
Sure.
We talk a lot about healthcare in America, and there's this sort of endless, crazy debate about Obamacare and Trump care and single payer and all the buzzwords and phrases. What do you think we're really missing when it comes to the general healthcare debate? Or what do you think of the tenor of the healthcare debate in general?
I think a lot of what people focus on in the healthcare debate is with regards to access with health insurance. Like health insurance, should we have single payer? Should we have free market healthcare? And I think that's an important debate, and that's been the focus of a lot of political philosophy and a lot of kind of political conversation about healthcare. But one thing I think we overlook are kind of clinical ethics, like the ethics of what happens within that clinical context, within the system, setting aside who pays for it, how we pay for it, things like pharmaceutical regulation, drug policy, public health issues. So I think that a lot of times people will sort of think about public health more in an instrumental way of like, how do we promote the public health? Like, what's going to save lives and balance in terms of public health policy? But not asking the broader question of should we be involved in thinking about public health as the kind of thing that public officials should be promoting. So those are some things I think are overlooked. So things like regulation, public health ethics, criminal justice and health, like how those two areas of policy intersect. And the clinical context, informed consent, self-medication, things like that, things that happen in the doctor's office.
Yeah, so I want to dive into all of those things for sure. So in terms of just the general idea of healthcare, are you for having the government have people buy into the exchanges and all that?
One thing to say about the United States system is like, here's like a place where like everybody can totally agree. Like, this is not the ideal system. Like, one thing we can all agree on.
That was going to be very hard to have everyone agree on something, and I think you might have done it.
That this is not a good system.
Yeah.
Whatever your favorite system is, I think this is like a non-ideal solution.
Yeah.
It's like very robustly bad.
Is there a system that you look at elsewhere and say they're really doing it right?
I mean, not really. I think that a lot of other systems have advantages and disadvantages that we could learn from. I think that it's sort of a weird historical accident that we have this crazy Rube Goldberg of a healthcare system that we have here. I think that Australia may be on the right track and having like a kind of basic minimum, but then like markets on top, although my impression is that they don't really do like drugs the way that I would like with respect to allowing more price competition in pharmaceuticals, but I kind of favor a more market-based approach, is my own view. But again, because we have a global marketplace, like the markets themselves are like not ever going to be necessarily what like your ideal of a market would be for healthcare.
Yeah.
But the first question you asked was like, should the government be requiring people to buy health insurance?
Yeah.
I don't think that they should. I think that how having health insurance fits into a person's values isn't really a choice that a public official is like well placed to make for everybody. It might be the case that people don't benefit dollar per dollar for health insurance as much as they do for just having the money. And so I think like a good benchmark for like, is this a good policy is, would a person benefit more if you just gave them the money instead of like spending the money on them, or requiring them to spend the money on a certain thing, spend their own money on a certain thing. I also have written elsewhere about, so that's like about individual mandates or individual requirements to pay into healthcare systems in particular. I've also written elsewhere about like employer mandates. So should employers be required to pay for health insurance if they have more than 50 employees for their employees? I don't think so.
Where does the 50 number come from?
I think that's just in the Affordable Care Act. It's like, or it was, I don't know how it's being implemented now, but it was about the time that I wrote that paper about it.
Right. So the implication being that if you're that big at that point, then it's something that the government should handle? No,
that then they could mandate that employers provide health insurance to their employees.
Over 50 you have to mandate.
Yeah, for larger employers. Right. And I think, one thing I think is that freedom of contract is an important freedom. And I think that when the government says, oh, you and I, we could negotiate a contract, but the contract has to contain certain terms, like a certain wage or a certain provision of benefits, I think that would violate individual people's freedoms of contract. And so I think people should be able to make labor agreements under whatever terms they want for the most part. And so the requirement that the government could say like, well, you have to pay people in health insurance, and that requirement would fall on people who are employing people who are already benefiting them much more than any other random people in the community are benefiting these employees. I think that would be a violation of freedom of contract. So yeah, I'm sort of against both. Yes, I am against the individual and employer-based mandates because I think that we should trust people to decide what in their contracts or in their personal spending choices are best for them.
Yeah. So in a weird way, as at least a one-time Obama voter, right? You voted for Obama at least once?
Yeah.
Yeah. That sort of puts you a little bit at odds with Obamacare, though, or not a little bit. That kind of really puts you at odds with Obamacare.
Yeah. No.
Yeah. So is that something you really struggled with as you were voting for him? Because right, I mean that's really his landmark piece of legislation, right? I mean that's the thing that he'll most likely be remembered for the most.
Yeah, I think why do people vote the way they do? I mean, a lot of reasons.
Yeah.
But no, I disagree with the Affordable Care Act. But yeah, so I mean that's one thing.
Did you make any sense of when they were trying to pass Trump Care or whatever his version of, or now even they're scaling back little bits of it or they're defunding parts of it. It's hard to pay attention, or not even pay attention. It's hard to track actually what the real world resolution is with this stuff. Did you see any goodness in any of that they were scaling back some of it?
I mean, it was changing like every week. It was like hard to even keep up when that healthcare debate was happening. My impression was that it was worse for people in that it like didn't really solve the fundamental objections people had to the Affordable Care Act, but that it created other problems in the markets, in the exchanges. But
so what do you do in cases of if you let it completely free market and you didn't have companies have to do anything under 50, over 50, whatever it is? What do you do for all the people that will just be left behind? I mean, all the people that were either just flat out dying because they weren't seeing a doctor,
right,
or the people that were then going to emergency rooms, which we know the costs of doing that are actually way higher than if they had care when they should have. What's the free market sort of answer to that?
Yeah, it depends on whether or not. So oftentimes people will say healthcare is a right, and what do you mean by that?
Bernie says it all the time. Ted, do you think healthcare is a right? Healthcare is a right. I believe it.
What do you mean by a right? So you might think that a right is always enforceable. If somebody has a right to something, then they have a right against other people to provide it.
To be clear, you don't think it's a right, I don't think, right?
Well, I just think it depends on what you mean by a right? But I mean, I don't...
Right, I mean, we have the right to life, liberty, and the pursuit of happiness, and we have the right, the Bill of Rights, but I don't think there's anything in there that says you have the right to health care.
Certainly not an enforceable right, a right that other people provide you with it. I'm skeptical of that claim. And so what would it mean for there to be an enforceable right to healthcare? What would it mean for there to be a right that you had a claim that another person provided with you? Well, it means that you could use the enforcement power of the state. Public officials could use their enforcement power to compel other people to provide their compatriots with healthcare. And then my question about that is, why healthcare? Like, why is the thing that people are required to be providing their compatriots healthcare and not something like a basic income, which I do support.
Yeah,
like I do favor basic income, or they could kind of decide how to allocate their resources themselves in accordance with their own value, or providing people with something like a basic standard of well-being. And then like if you wanted to like provide people with a set standard of well-being, a set of opportunities and health outcomes, it's not clear that like having them buy health insurance or have health insurance would be the thing that would promote that. So it's not even saying like health care is the right, it's like health insurance is the thing that people are saying is the right. And so in order to establish that there's an enforceable right for the public officials to compel people's fellow citizens to provide other people with health insurance, it would have to be that health insurance in particular was this thing that was so important for like human autonomy, flourishing, and well-being that it could warrant like coercively compelling people to provide it. Now, once we have that as our bar, like this is the bar, like I think a lot of other things would clear such a bar before health insurance would. I think it's like this,
what, for example?
Well, a basic income for one. I think that like having some kind of floor of material security would probably.
So basically, once you've said this is a right that we should have, there's a whole bunch of other things that using that standard you think would
be on the list before health insurance, right? And so if you think that there's an enforceable right that people should have health care, you'd have to explain in virtue of what do other people make themselves liable to be coerced by the government in order to provide their fellow citizens with that right. In virtue of what value? And whatever value that is, I would worry that there'd be like a lot of other stuff we'd be putting on the list before health insurance.
Yeah. Is there also like a part of it that it almost oddly sets people up against each other in a weird way? So if you take good care of yourself and you exercise and you eat right and you pay into the system and you're healthy, but then you go to the supermarket and you see someone buying a ton of soda and eating horrible foods that's overweight, never exercising, all that, that they're going to be more of a strain on the system than you, and you're basically paying for them. You know what I mean? And so
Yeah.
it would make you sort of almost angry at people for not taking care of themselves because they're then expending the resources that you're putting into the system because you're living better, so to speak.
I do think that there is sort of a link between support for like kind of spreading across the cost of healthcare and support for public health paternalism. I think that is the link, which is that people think that if they're paying taxes to support programs that are going to provide healthcare for people, that gives them an entitlement or a stake in the health of other people.
Right.
But then think it through. So say that you do think that healthcare or health insurance is an enforceable right, that everybody has a right to it no matter what. Then people don't make themselves preemptively liable to have their other liberties limited on the grounds that in virtue of their choices, their permissible choices, they're going to make it more expensive to enforce those rights. So by that I just mean, like, say that you're a person that just wants to eat like Doritos and Coca-Cola all day, which is delicious.
Reminds me of college.
I'd be sympathetic to that view. And then people say, well, like, no, you can't just do that, or you can't smoke cigarettes because if you do, then we're all going to have to pay for it. Well, then you might say, like, but wait a minute, like, who cares? Like, you have an obligation in virtue of my enforceable right to pay for it anyhow. And so, like, you don't get to tell me what to do just because subsequently you're going to have to give me what I'm owed, which is high health care. If you owe me $50 and you don't like how I'm going to spend the $50, you don't get to tell me to change my behavior before you give me the $50.
Right. I just think it's not an enforceable concept, but it's just, I think it would just cause resentment. I think in general, like if you're just like, I don't expend a lot from the system. I don't take a lot from the system. And here are other people that do. It's just sort of human nature, I think.
To resent, like,
to sort of resent it. Yeah.
Maybe. I mean, I don't think that they should if they really think that they have a duty to provide it.
Right. Well, I don't know that people really think it through all the way. And maybe a certain amount of people don't think they have a duty to provide it
and
in the
if
first
they don't
place.
think they have a duty to provide it, then their issue isn't with the people eating Doritos and smoking cigarettes. Their issue is with being forced to provide other people with health insurance, which is, a different gripe. So like, either way, if you don't have any kind of grounds to resent or to want to limit the freedom of the people who just want to smoke cigarettes and eat Doritos, because like, which I feel like I'm like hating on Doritos here.
Let's not make this about Doritos.
Yeah.
Everybody loves the Cool Ranch.
Which, right? But so I feel like, if you're a person who thinks healthcare is a right, then you have no grounds to want to limit the choices of those people because you, by your own lights, think that you have a duty to provide them with healthcare, whatever their choices are.
Right.
And if you're, irritated by people making making choices that could be prevented with public health paternalism that you disapprove of, on the grounds that you don't want to pay for their health insurance, then what's doing the work is really just that you don't want to pay for their health insurance. And so then you also don't have any real beef with people making bad health decisions.
Right.
And so either side, I don't think, should support public health paternalism. Interesting.
You've mentioned cigarettes a couple times. It's funny because literally my chest is tight right now. I don't smoke cigarettes, but from the smoke outside, like I can feel it at this moment. And I always think the cigarette thing is kind of interesting because I used to live in New York City, and I'm pretty sure cigarettes were something like $12 or $15 a pack, like taxed beyond imagination, which I always thought was an odd thing because it's like you're taking people with this vice and then, and an addiction, a true addiction to tobacco and all the other stuff that's in there. And then you're making all of this extra money off it that the government then needs to do whatever it's doing. Yeah. So it's like a doubly abusive thing in a way. Not that you should just be giving cigarettes away for free, but taxing these vices, these addictive vices, you're just taking more money from those people and putting it, now you're going to need, the government never wants less money, so it's never going to be like, all right, we're going to tax that lower or we're going to stop spending.
Yeah. There is some evidence that cigarette taxes do reduce smoking, which makes sense unless you think that cigarettes are sort of this like uncontrollable compulsion that people have, which would be interesting then that if you increase the price of it by $1, then people stop doing it.
Right.
So then it looks
but then
like
you're
it
also
is more
saying
volitional.
you're saying a poor people, then it's probably poor people that then can't afford it. So then it's like, well, poor people shouldn't be allowed to smoke cigarettes, which I think some people would have an issue
If that
with.
is the way it goes down, I don't know. But I do think that sin taxes in general, or like cigarette taxes on things that the government doesn't want people to do, like soda taxes are another example, they are regressive for sure. I mean, just because the marginal value of that dollar is going to be disproportionately, the marginal impact of being taxed an additional dollar will be disproportionately harmful to people who have less money.
Right.
And so we have these regressive public health taxes that are going to disproportionately burden the economically worse off. And I also think that they're very expressively harmful because they express disapproval of certain people's choices on behalf of the government, which it's not morally wrong to smoke cigarettes, it's not morally wrong to drink soda, and so I don't think that the government should be expressing disapproval or limiting people's rights to make choices that are permissible.
Right, and yet I think there's some sort of argument that says if the government's going to give health insurance to everyone, that maybe then at the same time the government has a right to tell you, I don't agree with this, but I can see the argument, though, that, all right, the government's going to give health insurance to everyone, well then why can't the government say, you know what, and you can't smoke cigarettes and you can't drink soda with high fructose corn syrup because we know it's going to give you diabetes, which is also going to be a strain on the system. Again, I don't agree with that, but I can understand that line of thinking.
Yeah, if that were the argument, then I would think that then you should let people opt out. So it'd be like, hey, free health insurance in exchange for not smoking or drinking soda or exchange for exercising or something. I don't think people would be on board with that, though. I don't think that they would like it if there was a policy of making the provision of public services conditional on people behaving.
Right. You'd have a black market, basically, of soda. People would be secretly smuggling soda.
Or, I mean, what I was saying was like, maybe if taxpayers like, oh, we don't want to pay for people's health insurance if they're going to make these bad choices, that still doesn't justify banning the bad choices because you could just say, if you want to get, publicly subsidized health insurance, then you can't make these bad choices. Then you can't smoke or then you can't drink soda. Yeah. I don't think people would accept that. I don't think people would say that was their ideal of a publicly provided health insurance system, where it's like, if you want to, where people would have to voluntarily limit their liberty in order to have access to it.
Yeah.
I don't think that most people who support like Medicaid for all would support a system where Medicaid for all, but people can opt out of it in exchange for the right to smoke cigarettes.
Right. It's interesting because I would always veer on more choice. And yet we find ourselves in a place where it's like, well, people are going to do bad things and you're just going to sort of have to pay for it if we have less choice. It's just how it is.
Wait, so go through that argument again?
That if you have less choice, meaning the government's going to make you have health insurance or whatever it is, that people are going to do bad things and you're going to sort of have to subsidize it. It's just how it is.
Or ban it, right? I mean,
or ban it, which I wouldn't be for banning it. I wouldn't be for banning it,
Yeah.
It's an interesting thing. I mean, in the cigarette one, I think it's particularly interesting because the government, you're saying, this is something bad. We all agree this is bad. The government's now going to make a lot of money off something bad, and it wants money. So it almost wants you to smoke cigarettes. You know what I mean?
Yeah, I don't know that the government wants people to
But they want
cigarettes.
that money, and they know it's a way to make money, right? I don't know that I don't think they're sitting in a thing going, we got to get more people smoking cigarettes. But when they look at the numbers and they're like, wow, look at all this money we took in from cigarettes, I think they probably view that as a good. They want more money.
But I think at the same time, public officials are definitely invested in reducing long-term healthcare costs and reducing rates of smoking. And so, I mean, it's hard to, like, I think people often use this idea where they're like, the government does this or like the government does that. But like, there's not one thing that like is like the government, right? It's just public officials with different kind of motivations. And so, but I don't think that many public officials are motivated of like, oh yeah, let's raise money through cigarette taxes. I think that the primary motivation of people who pass cigarette taxes is to deter people from smoking.
Right.
But I don't think I don't even think that's a good motivation. I mean,
right. I don't know which the primary motivation is. I don't really like either one of them.
Yeah.
All right, fair.
Like, it's bad enough if they're just like, oh, we want to like cast judgment on people's permissible choices in order to discourage it. Like, I think that's like, I mean, I think that's sinister enough if you want a reason to oppose the cigarette taxes.
Yeah. All right. Well, I think we hit the basics of sort of the main public policy stuff that I wanted to get to. Let's talk a little bit about medical ethics in general. Define medical ethics for me.
What people ought to do in healthcare and medical contexts.
And you want people to have more choices than they currently have.
That's right. Yeah. So I wrote a book, Pharmaceutical Freedom.
Yeah.
Christmas is coming. Makes a great gift. Just saying.
We will have a link in the description down below.
And the argument for the book is that the same reasons in favor of informed consent, which is a core principle of medical ethics, are also reasons in favor of rights of self-medication.
Yeah, wait, let's define some of the terms. So informed consent is
that physicians are not entitled to make medical decisions on behalf of their patients as long as their patient is competent. And patients have rights against being coerced into making particular medical decisions. Medically competent patients are, not children. And that it's also impermissible for physicians or anyone else to deceptively mislead or withhold information from a patient in order to get them to make a medically advisable decision.
How do you actually figure out what informed means, what the word informed means? I mean, when I've been to hospitals with grandparents sort of at the end of life and when they're trying to do the last few things that they can do and they say, well, we can do this or that or, you know, all these different things, they're explaining it usually to you, but you don't really feel informed. Like you really don't know unless you're a doctor yourself. So how do you actually define what informed really means?
Is that the patient should be informed up to this kind of reasonable patient standard? So like what a reasonable person would deem relevant to the content of their decision. And so that includes both information about the risks and benefits of a particular treatment, but also information about treatment alternatives, and also information about the risks and benefits of having no treatment, of declining treatment entirely. So that's the sort of broad standard of what level of information is required for a patient to have access to. Some patients might want to not know certain information. This is becoming increasingly an issue with things like information about genetic risk factors, for example. And so then patients should have the right to also kind of consent to the uncertainty, perhaps. And so say like, well, we could disclose genetic risk factors from this analysis unless you don't want to know. I think
so in effect, you then would be opting out,
that's
and
right.
then you were sort of waiving any of your legal rights, I assume, after.
I don't know what the legal context is, but I think morally patients should be entitled to essentially exercise as much control over the amount of information they want with respect to their medical choices, and also to have unrestricted access to whatever information they would deem relevant to their medical choices, but that doctors should be on the hook to provide patients in the context of medical decision with whatever information a reasonable patient would want to know about the risks and benefits of treatment, treatment alternatives, and no information, or no treatment.
Right, but so in effect, though, you as a patient could say to your doctor, there are things that I will not want to know. And your doctor...
Yeah, my own view is that that's true, that like patients should be able to opt out of knowing, although they will have to like re-up.
What would be an example of something like that?
So I think that the primary example where this is an issue is with testing for genetic risks. So if physicians know that a person has a latent life risk of a certain disease, should the physician be required to disclose it to the patient? And I think that the physician should be required to disclose that the test might turn up certain diseases and then ask the patient if they want to know, because some people might prefer to live in ignorance of that type of knowledge. That's controversial in medical ethics, whether or not patients should have a right to know. But informed consent is less controversial outside of those those are kind of marginal cases.
Right.
So like outside of those more marginal cases, we're all familiar today with what informed consent requires. So you go to the doctor, you say treatment A, treatment B, what are the risks and benefits of the two? And the main idea of informed consent is that you are the author of your own medical choices. You're the person that's in the driver's seat, not the doctor. And so the doctor can't trick you, mislead you, withhold information, or coerce you in order to get you to make a decision that the doctor thinks is medically advisable. It didn't always used to be this way. So the emergence of informed consent happened in the 20th century. Before then, physicians were very paternalistic towards people, and even well into the 20th century. So there was a survey done in the late 60s of oncologists about people who were diagnosed with cancer, whether or not they always accurately revealed the diagnosis. 90% of oncologists said that they did not always accurately reveal cancer diagnoses to their cancer patients.
Meaning that they were confused
That
at the results in the first place?
That they would withhold a diagnosis from patients paternalistically for fear that the diagnosis would be harmful to the patients if they knew it. Sometimes even substituting in an alternative diagnosis. I know this was 1968, I think the study was. So informed consent.
Explain that a little further. What would be the legitimate, if you were an oncologist and you knew that one of your patients had cancer, what would be the argument for?
At the time they thought that there was at least in some cases, the oncologist would withhold or mislead patients about their diagnosis on the grounds that they thought that the information about the diagnosis would be harmful to the patients.
Wow, I mean, that's incredible.
Yeah, but now we think that that sounds bananas.
Yeah.
I can't believe that was just very recent. So informed consent has only robustly been with us for the past 50 years or so in this way. And now it's baked in. We all understand, like, yes, it is wrong for doctors to mislead people or to lie to people about their diagnosis. It's wrong for doctors to coerce people into accepting surgery. So the first informed consent case was in 1912, 1913. And it was a case where doctors performed a hysterectomy on a woman without her consent. She actually explicitly said that she did not consent to surgery. Then she was being examined under ether, and the doctors removed her organs. That doesn't happen anymore, or when it does, it's like a big deal. Like, it's medical battery, it's a form of assault. So we now think about patient choice and people's control over their health in a much more respectful way, I think. That's been like a sign of moral progress. Like, I believe in moral progress, that the world's, capable of morally improving. I think this is one example. At the same time, however, across the 20th century, patients slowly lost rights of self-medication. So while over the course of the 20th century, patients were gaining the authority in the doctor's office to make medical decisions for themselves, they were losing that authority at the pharmacist. And so the book is about why the same reasons that give patients the authority to make medical decisions about their own bodies in the clinical context are also reasons in favor of giving people rights of self-medication in the marketplace and in the pharmaceutical context.
So how did we lose control of some of that related to the pharmaceuticals?
Well, there were a series of drug disasters. First, elixir sulfonamide in the 1930s, and then the thalidomide disasters in the 1960s, which the United States avoided because of a regulator at the FDA who was very cautious in approving the drug application for thalidomide. Those drug disasters led, at both times, for public outcry for increased pharmaceutical regulation. First, for safety.
Can you tell me a little bit more about what the drug actually was?
Yeah, so elixir sulfonamide, sorry, there's like fires outside.
I mean, I'm feeling it right now. We're in a health crisis right now while we're doing this.
Elixir sulfonamide was essentially an anti-infectant that was diluted with something like antifreeze. And it was distributed in the 1930s. And when this drug was diluted in this kind of antifreeze-like substance, diethylene glycol, a lot of people, mostly children, died from taking it. And after the children died from taking it, there was a lot of media coverage. The drug was recalled. There were lawsuits, but there wasn't really much of a legal basis for punishing the people besides the fact that it was mislabeled. And so there was public outcry against the fact that this very dangerous medicine was being distributed to people and they didn't have an opportunity to consent. The initial drug regulations that passed authorizing the FDA stipulated that it was only intended to make self-medication safer and more effective. So in the 1900s, rights of self-medication were widely affirmed. People believed in rights of self-medication. And the initial regulations that were passed were just supposed to be like labeling requirements, making it so people could be informed about what they were taking. But the approval process quickly evolved into a safety standard, requiring pre-market safety testing in order to establish that people knew what they were getting when they were taking a drug. By the 1960s, when the thalidomide disaster happened, which was a drug that was used by pregnant women to treat morning sickness, and then it caused miscarriages and then some children to be born without limbs. It mostly hit in Europe, and we avoided it because of our drug approval process in the United States. By this time, the FDA became a kind of model for the world about drug regulation, and that still is true today. So a lot of other countries kind of mirror their regulatory approach off of the FDA. And the United States avoided it because of regulatory caution with respect to a new drug application. But seeing the pictures of the infants that were born without limbs from thalidomide, there was once again a great deal of public support, and the FDA passed, Congress authorized the FDA to enforce efficacy testing requirements as well. So now, in order for a drug to be brought to market, it needs to be shown that it is both safe and effective before being brought to market. That sounds like a good idea.
The road to hell is paved with good intentions. Continue.
But now say that the FDA approves a drug and it says, we fast-tracked this drug. It got approved very quickly. We approved it, from basic research to approval 5 years, which would be very, very fast. And now we expect it to save 10,000 lives a year. The way that you should perhaps hear that is that tens of thousands of lives were lost during every year that approval for the drug was withheld. People see the children who died during the elixir sulfonamide disaster, the thalidomide babies, but people don't see the people who look like they were dying of their diseases, but they were actually dying because of regulatory caution.
Because they couldn't get access to drugs that could potentially help them.
Yeah, it's not as vivid to us when people die for a lack of access to drugs, but it really is the case that though it looks like their diseases are what's killing them, what's actually killing them is the lack of access.
Yeah, so this is kind of a tough place for someone with certain libertarian leanings like yourself to be in, right? Because you're acknowledging the FDA did some good work in the first place here, but then that, right? Like, right? I mean, I think you are, I don't want to put words in your mouth, but you're acknowledging that by having this regulation at first, it stopped it from coming to the United States, correct?
Well, I mean, I don't even think that necessarily, because the approval process for the drug wouldn't have even been for pregnant women. Most pregnant women use drugs off-label. I think that people saw it as a win for the FDA because the FDA didn't approve the new drug application, and so the United States largely avoided the crisis. But I don't think that the current system would have prevented a crisis like thalidomide in the United States, because very few drugs are approved for use in pregnant women. And so it's like sort of this weird historical accident. Like, I don't know that we should credit the FDA in this way for like intentionally preventing that. Now, so like when you're like, oh, you credit the FDA with certain things, I do think one thing the FDA does that is good is that it enables informed patient choice. It certifies drugs. So my view is, like, if you like the FDA, which I know a lot of people do, it's one of the most popular regulatory agencies, fine, let it do everything it does now. Let it certify drugs like the Good Housekeeping Seal of Approval. I also think there should be other certificatory agencies for drugs. It's like when you go to Whole Foods and there's like 15 different certifications on all of your different eggs.
They got a lot of things on those boxes.
Yeah, let any drug have all sorts of certifications, but including, as we have with food, like USDA, like let them certify drugs. What I object to is the FDA prohibiting drugs, which they have been doing for a long time. And so withholding access to drugs, I think, violates people's rights. It's a violation of their rights to make decisions about their own bodies.
Yeah. Are there any particular drugs at the moment that they're withholding that you think are real game changers?
I mean, it's always hard to know. I mean, that's the reason that they do withhold it, is because there's high uncertainty for unapproved drugs. There's also high uncertainty for approved drugs. But
yeah, I wanted to ask you about that, actually, because everyone knows. I mean, it's a joke that everybody makes. You turn on the TV, you watch any commercial. Half the commercials these days are for prescription drugs. They tell you a little something good about it at the beginning, where the guy's running in the field and everybody's happy and he's on a mountain. And then the 3/4 of the commercial really are about the diarrhea and vomiting and upset stomach and thoughts of suicide and restless leg syndrome and blindness and a gajillion other things. So something seems wrong with the way we are medicating ourselves, or the way that these things get passed. It's almost as if our bodies are telling us not to be on half of this stuff, not to say, I have friends that are on different things, and I had a friend that was really helped by lithium and a bunch of other things, but that there's some odd thing that we're doing with over-medicating, or that we push this stuff on ourselves constantly.
Whether or not a person should use any kind of a drug is a decision that should just be made in terms of the risk-benefit calculus for their own life as a whole. And who's the expert about your life as a whole? You are. And so what happens with the FDA is that they impose these broad-based judgments that apply to everybody when they prohibit a drug or when they withhold access to a drug before approval, that say that the drug is unacceptably risky. And then when they approve a drug, they say that this drug was approved because the risks are acceptable in light of the benefits. Now, that's not a scientific judgment. That's not a judgment that the FDA is well placed to make. Whether or not something's acceptably risky is a normative judgment. It's a judgment about what you should do with your own life and your own body. So medical experts, doctors, pharmaceutical regulators, public officials are not experts about whether or not something's acceptably risky. The person who's an expert about whether it's acceptably risky is the patient. Now you seem to be saying like, well, patients are taking too many risks, like they're using too many drugs.
Well, it seems like we're inundated with so much of this that everyone, I mean, I think we're the most over-medicated country in the world. You can correct me if I'm wrong, but I think it's something like, I don't think, isn't it illegal for some of these commercials to be on all the time in Europe? I'm pretty sure they have laws against some of this stuff. And yet for us, we're slammed with it constantly. And I think that causes your ability.
Do you think that that's bad, that there's so much pharmaceutical advertising?
I'm not for overregulation, so this is one of the places where it's a struggle, right? Like, I'm trying to be intellectually honest here. I'm not for overregulating these things, and I'm always for more choice, so I understand the argument. But the general, allow me, please. But the general idea that we're slammed with so much of is that it makes your ability to make a clear-minded choice more difficult. And we're going to talk about critical thinking a little more at the end.
Because I think that, well, I'm in favor of direct-to-consumer drug marketing, which the United States is one of only a few countries that allow it, and I think that's good. I think that's like part of our sort of strong commitment to freedom of speech, that we do include commercial speech to an extent within that. And I think that if the government were to say no pharmaceutical advertisings, that would be a content-based restriction against speech that advocates in favor of lawful conduct on the grounds that the government doesn't agree with the message.
Yeah, so I'm not...
So you should be worried about that.
Yeah, trust me, I'm a free speech guy. So I'm not against it. I just think our ability, I don't know what the answer is. I'm just saying that our ability to make informed choices about the drugs that they're pushing on us all the time seems to be very slippery.
But maybe we have that slippery ability because we haven't been given the autonomy to make decisions about our own health. Maybe it's a kind of learned helplessness from the fact that currently, people aren't authorized to make choices about their own health. So given that we have a prescription requirement system where you have to go to a doctor and get the prescription, maybe people offload to physicians and then they accept more risk than they otherwise would have, because they think, well, if a doctor would have prescribed it, then it's fine. And then the physicians have this other way of looking at it, where they're like, well, if the patient wants to take it, like the risk is on her. And it could lead to more risky decision making. There's some evidence from an economist from the 70s who did research on this, Sam Peltzman, that prescription requirements actually induced more risky decision making and result in higher rates of accidental drug poisonings because of this sort of offloading effect, where people think that if a doctor told you it was okay to take it, that it's okay to take it. So
that's really interesting to me. Right, because they're like, the doctor said it's okay, so I'm going to go ahead and do it. I don't even have to listen to the people telling me that I'm going to have diarrhea and thoughts of suicide and all the rest of it.
Where people are, they take less, they're less cautious because they feel like their decisions are authorized by first the FDA. The FDA approved it, it's an FDA-approved drug, and then by their doctors, and so they're more likely to take on risks associated with using these drugs.
So in an odd way, by removing some of these restrictions, it would actually strengthen the doctor, you think, because it would be on the person to then take the responsibility for themselves.
I mean, I've talked to some doctors about this, and they kind of, like, you might think that doctors would be like, oh no, we need to keep prescription requirements, but they think right now, look, maybe I could focus more on patient care. Maybe we could, focus more on really having a conversation with patients who want advice from a doctor. I'm not saying people shouldn't talk to their doctors before making decisions about which drugs to use. I'm saying that after they talk to their doctors, the decision should be in their hands. And that if they don't want to talk to a doctor, that's also their decision.
Yeah. Well, you're also saying actually listen when they list all of those side effects.
Yeah.
Because I think that's part of it. Like, you don't even listen to that part, and it's why their marketing is so good. All these people are having a great time while they're on Valtrex, you know what I mean? And then you find out what all the side effects are, but you don't really, oh, well, that won't happen to me,
Yeah, I think that, patients should have the autonomy to take responsibility for their health, have the authority to make decisions about themselves, and they should take that seriously, and they should educate themselves. And I think that also they should have access to the relevant information. I don't think that, I would favor, fair labeling requirements, making labels accessible for people to be able to understand the risks and benefits of the treatment. But ultimately, whether or not a decision's acceptably risky, whether the risks outweigh the benefit, no one can make that decision for a patient except for the patient.
Yeah. All right, so the through line here, I think, is more choice. Fair to say?
I'm usually going to be in favor of more choice.
You're a proponent of effective altruism. That sounds pretty good. What is effective altruism?
So Peter Singer is known for as a proponent of this, and I really admire Peter Singer, and I think that he's pretty persuasive on this, which is that though I'm not a utilitarian and I don't agree with him on a lot of other things, I do think that he's right that a lot of people who are in rich countries have the capacity to do an extraordinary amount of good by donating to effective charities, and that it's morally good if they do. And so the idea of effective altruism has two parts. The first is the altruism part, that comes first, which is that it's morally good to give. It's morally good if you're fortunate enough to be able to give. And what they recommend is 10% of your income. And then if you are going to give, once you're like on board with the view that it's morally good to give to people, to promote well-being, to promote people's health, well, where should we be giving? Who should we give to? And you should give to the place where your donation can do the most good. And so charities that I favor as an effective altruist are the Against Malaria Foundation, which mostly focuses on bed nets, bed net distribution, and Give Directly, which is cash transfers to poor families in Kenya and Uganda.
Yeah. How do you figure out who's using the money properly? You know, you always hear a story every now and again of nonprofits that you think you're giving all this money to them and that they're going to, clean water or whatever it is. But then later you find out like 80% of the money goes to administrative costs or for them to throw parties, for fundraisers to just get more money to throw more parties or that.
There's a great website, givewell.com, and GiveWell has a team of researchers which try to evaluate which charities they think are going to be the most effective. And they recommend both Give Directly and the Against Malaria Foundation. One nice thing about Give Directly is that cash transfers are pretty easy to administer. You can just do it over mobile bank transfers. And the Give Directly team has a lot of people who do really good follow-up to see what the effects are. So they can see they'll randomly assign villages to get the transfers, and then they can see the effect of having the cash transfers as a anti-poverty intervention. And it does look like cash is like a very effective anti-poverty intervention.
Yeah. Is this also, in effect, an argument for lowering taxes in general, that if people had more money in their pocket, perhaps 10% more, they could give 10% more to things that they really cared about?
I think that there are lots of good reasons to lower taxes, because I think that currently, like, some of what the government does with taxes is like not great. For example, war. I'm very against war. I don't know that this is the best argument for that.
But that generally, if you had more money in your pocket, you might be willing to give more money to causes that you really care about.
I think people should be willing to give to causes that they care about, whatever their tax rate is.
Yeah.
And I think that people should care about causes that do the most good, dollar for dollar.
Yeah. So you're also writing a book on sex work.
Yeah, it's a for and against book.
That wasn't a great segue there.
Yeah.
Yeah.
Yeah, it's a for and against book. So I'm the for decriminalization, and I'm writing with a co-author, Lori Watson, and she's against decriminalization. Yeah.
So what's the argument against it at this point? I mean, this is another place that I go very much to the libertarian side, which is that if a woman or a man or whatever wants to take control of their life and be a prostitute or be involved in sex work, and it's an even exchange, and they're doing something for money, I have no problem with any of this.
All right, cool. So, one less person I need to convince.
There you go. All right, so I'm with you on this one.
So who am I arguing against?
Yeah.
There's a lot of people. So some people have a view of like sort of sexual moralism, that there's certain norms that should govern people's sexual choices. That's like a kind of more traditionalist view. I think that people who hold that view aren't entitled to use the government as a means to force everybody else to live in accordance with it. There's a feminist argument. People worry that having sex work, especially pornography, but sex work more generally, will contribute to the subordination and objectification of all women by promoting sexist ideas of female subordination or views of women as objects.
But to be clear, sex work isn't only about women. I mean, there are plenty of men involved in sex work.
Yeah. But feminists focus on the detrimental effects of the sex industry for women as a whole.
Right.
Often. There are arguments about occupational health and safety related to the dangers associated with the profession. I don't think that the profession's more dangerous than being a commercial fisherman, for example. But
right, and aren't there studies that show that, like in Amsterdam, for example, that the women that are involved in sex work are in unions, and that they've been able to bargain for better health care and things like that?
To be sure, I think a better ideal, the policy that I favor, is out of New Zealand, where it's just treated like all other kinds of work. But of course, if you're concerned about the risks, the occupational health and safety risks of sex work, you should be concerned by black markets as well, equally, and black markets are more dangerous. So yeah, there's a kind of traditionalist argument, there's a feminist argument, there's a kind of a labor argument. A lot of people worry that it's exploitative, and by that they mean that if a person makes a decision without having any acceptable alternatives, then though the decision's not coerced, it's not sufficiently voluntary to merit respect. I think that that could apply to a lot of work. A lot of low-wage work, especially. People will only choose to take those jobs at the wage that they take it because they lack acceptable alternatives. I think that we should therefore favor a basic income. So I do think that it's a problem that people only choose certain types of jobs or to work at all because they lack acceptable alternatives. And I can talk more about why I favor a basic income.
Yeah.
But I also think that if you don't favor a basic income, the voluntariness concerns don't warrant prohibition of sex work. So if the problem is that people who are choosing to work in an industry only choose because they have very few options, I don't think that an acceptable solution to that is to just straightforwardly prohibit the few options that they do have. There's parallels arguments in international global justice about sweatshops, where it's like people like only choose to work in sweatshops because they lack acceptable alternatives. I don't think the solution would be to ban sweatshops or to even enforce regulations that would lead sweatshops to go to another place.
Right. And half the people screaming about it are holding, have iPhones in their pockets, right? I mean, it's just a fact.
And I think that, when people are concerned about these types of labor issues, sex work, sweatshops, they are genuinely concerned for the workers. Like, I don't think that there's a sort of bad faith there. But I would press those people to say, like, well, what is the alternative that goes along with the ban? I mean, it's very easy to say, I don't approve of this circumstance, but then, like, what is your solution, I mean, yeah, like, I favor a basic income too, but, like, failing a basic income, I don't think that further limiting the options of people who are already suffering for a lack of options helps them.
Yeah, so what would a basic income look like to you, done correctly?
Well, I don't take a big stand on, like, how much it should be. Why do I favor a basic income? You might think, like, oh, you're a libertarian broadly, like, why have the government redistributing people's income? And that's what you were saying, like, oh, I'm against, like, a high tax. It's like, I don't really have too much of an opinion on how high taxes should be necessarily per se, or like, but I have more of an opinion on what they spend it on, what public officials spend it on.
Yeah, well, I do agree. It's mostly about spending and not about taxes. We got to cut the spending down, and then the government would just need to take less from you if it would stop overreaching on what it thinks it's supposed to do.
Yeah, and so, like, I'm against a lot of what public officials spend the money that they tax people on, but taxes in particular, I'm a little bit more ambivalent about. I mean, I kind of think, given the political institutions we have right now, like, no, we should oppose kind of raising money to go to war. Like, I think that'd be bad, because I think war is bad. But should we be, in principle, opposed to taxes per se? That's a little bit more complicated. So say that you're a broadly kind of libertarian person. A lot of people will say, that means that, nobody should violate another person's natural rights. But do people have natural rights to not just their bodies, but external objects, property out in the world? So one of my favorite philosophers, Michael Huemer, is kind of like an anarcho-capitalist, and he's like, well, at least some stuff out in the world. If you build a hut, like, in the woods, and, like, you live there, someone can't just, like, roll in and, like, knock it down. Like, you have a natural property to that. But some other property rights are going to be conventional. Some property rights are going to exceed whatever natural rights we have. So, like, money, that's a good example. That's a very conventional system. So now you have a government, and the government says, okay, here's the property system that we're going to enforce. Well, one thing that property system should do is it should respect everybody's natural property rights and natural rights to their own bodies, whatever that is. But then the government goes further and they're like, and also, we're going to enforce all of these property conventions, and we're going to use the coercive power of this government that nobody consented to, like none of us signed up,
right.
to enforce these kind of property conventions. And the thing about these property conventions, let's call them capitalism, is that they're going to make people generally better off. But they're going to pick winners and losers. They're going to make some people worse off, some people really, really badly off, some people fantastically well off. So we have the government that's enforcing protections for people's natural rights, but also establishing these property conventions. How are the property conventions enforced? Oh, the property conventions are enforced in part with violence, with coercion, which is a threat of violence against people's natural rights, their rights against being threatened with violence. And so I don't think that, I don't favor basic income as an ideal theoretic solution. I think ideally nobody would use violence against anybody without their consent. But given that we have governments which are using violence to enforce laws and property conventions against everybody without their consent, a basic income is a way of compensating people for that injustice, for the injustice of the enforcement of a coercive property system that enforces conventions the enforcement of which requires violating people's basic rights.
Yeah, it's interesting because I've heard a couple different libertarian arguments for basic income, and on its head, if you were just looking at it, you would think that just makes no sense, and yet I completely understand what you're saying there. What is the inherent problem, though, that once you set this income, and I'm not asking you for the number that you're giving everybody, but once you set this, that just the way economics works, I mean, you're just going to increase the cost of everything else for everybody, right?
So they've seen basic income studies, and I mean, the evidence is weak. Of course, there's not been a full-scale, great, ideal basic income enforced. But
I'm giving you a basic water level before we choke to death.
But there will still be incentives to work, and there will still be positional goods and positional advantages. All the basic income should do, I think, is give people the freedom not to participate in the labor economy,
right,
if they don't want to.
I guess the thing that I struggle with is that once you set it, that you will always have politicians coming in that want more votes from the people that are getting it, and they're just always going to say, raise it, raise it, raise it. And that every year that goes by, we're just going to raise it and raise it and raise it, and that will raise the cost of everything else. That, to me, is the human part of it that I struggle with, that it's just nature. Every politician's going to be like, well, if I look at my district, we have a lot of people on it, let's raise it, I want more votes.
Yeah, and so I don't think that the basic income, and this is true of basic income advocates across the political spectrum, very few will ever say that the basic income should be raised so high that it depresses the total pie. So you want the basic income to be as high as it can up until the point that it doesn't swing overreach in the other direction.
Right, but is that just not the way politics works? I think that's sort of what I would say is the problem. That I get you, I'm with you. You know what I mean? I completely understand that. But just the nature of the political system, you're going to give them this power to do this, and then always they will raise it. And whatever that threshold is that you're talking about, of course they're going to run over that.
Yeah, but that's going to be true of whatever your kind of political ideals are. Is that you're always going to have a concern about these sorts of public choice worries or electoral incentives that are going to cloud people's vision. I'm interested in what does justice require? What's the truth about what justice requires? And I think that a mistake that libertarians often make is that they're sort of question begging in their arguments for having property rights. They'll just be people have rights to their property rights without explaining why, where those property rights came from. And I think that what justice requires does include a respect for certain kinds of property rights, whatever the kind of natural rights are, but that oftentimes the enforcement of a property system far exceeds that. And so, as a matter of justice, the basic income could be a form of compensation for that initial injustice. So that's a very in-principled argument. And you're kind of asking oh, but in practice, wouldn't that
right.
really go
I'm just sort of giving you the rubber meets the road one.
Yeah.
I get it at the philosophical level for sure.
But then, so you might think well, what's the point of this defense of the basic income if in practice it wouldn't? But you always have to have some kind of ideals about what you think is true about justice, just to ground what are your kind of North Stars for what policies you advocate for now. And so where the rubber meets the road, you might think is, well, now given that we have this view, how do we assess existing policies? Here's one way to think about this being informative. think about cash transfers as benchmarks for any kind of assistance program. So like, I think that cash is a more respectful way to help people because it respects their authority to decide how best to help themselves or how to make choices that reflect their own values. And so, whatever intervention public officials want to enforce on behalf of people in order to help them out, let's just hold it up to a benchmark, a per person benchmark of like how people could have used that money individually if you just like sent them that money as a check. And like I think that some programs will probably beat that benchmark, but just thinking in terms of using a cash transfer as a benchmark for evaluating the justice of different things that public officials use redistributive taxation to do, that's like one practical implication of thinking about a basic income as being required by justice.
Yeah, it's interesting. All right, I want to finish strong on critical thinking. Because
Right.
it's a phrase that I mention often on this show that I think if we're lacking one thing in this country more than any of those, it's critical thinking, the ability to think clearly, look at a problem, understand your intellectual opponent's argument as opposed to just what you think their argument is, not impugn everyone's motives. I mean, that's basically what I've tried to do on this show consistently for a couple of years right now. Do you think we're at like a critical thinking disaster moment right now? Like we don't seem to, we don't, like just in the public discourse.
It sounds like you
well,
do.
I think in the public discourse, maybe not when you're with a lot of academics that you're spending time with, but I think the general public discourse really lacks critical thinking. It's like we've picked our sides, we're yelling at each other all the time, we're demonizing constantly, all of that. We're not thinking about issues really clearly and critically.
More so than the past, do you think?
I think partly the internet has caused this, the Twitterification basically of everything and the short way we think about things, and we go from one crisis to the next crisis, or we're outraged about something one day and then we forget about it the next day. Even if you look at the shooting in Las Vegas about 2 months ago, I think 58 people dead, it seems like there's almost no information about it. Like we just let it go, we just forget things, which I think is a part of critical thinking. Like we just don't look at things sort of holistically and try to figure out what really is true.
Yeah, although you might fall into like a sort of availability bias where like you see people on the internet shouting at each other and being mean and like, people kind of acting in bad faith or being hypocritical, and you're like, oof, critical thinking, worse than ever. But then like look at the past which I think like the past was by and large just a terrible place.
Yeah, I'm not saying it's worse than ever. There's something about it that feels perhaps because of the internet worse, but generally I just don't think we're in a good state right now when it comes to critical thinking.
But what's your counterfactual? Because like
when was it better, basically?
And so like you might look at the internet now.
I would guess I would say it would probably better around the time of the founding of the country, that the founding fathers, at least when they were writing documents, these were principal documents that they were having Lincoln, Douglas, that's not founding times, but
I think Thomas Jefferson was a real
debates.
critical thinker there.
Yeah, absolutely. Thomas Jefferson is my favorite founder. What are you going to say about Thomas?
Thomas Jefferson's your favorite founder?
Yeah. What? What do you like about Thomas Jefferson? I love Thomas Jefferson.
What do you mean? What do you like?
His understanding of liberty and liberalism and what the role of government should be.
Interesting that he's like writing the Declaration of Independence while he is owning slaves, and
you're right.
He was a rapist.
A complex.
He was bad. Like I was not good. I felt if you're going to pick a favorite founder, I would not pick Thomas Jefferson.
George Washington owned slaves too.
Yeah, I don't think
and didn't free them till his deathbed. But that to me that just shows that these were complex people of their time.
Yeah.
Thomas Jefferson, you're right. He was writing the laws to free the slaves while he owned slaves. And I went to his house in Monticello, and they give a really, I think, very forthright explanation of what his life was like. But if you go to the Washington Monument, and I was there just a couple weeks ago, and you really read the things that he was writing about, he was a flawed human. But there are things that 50 years from now, they're going to look back that we're probably saying right now.
That's exactly right, yeah. And I think that is one of the values of critical thinking, is to try to look around where we are now and be like, okay, we know that in the past, it was like a moral catastrophe for women, for people of color. Like the past was such a bad place, and very likely in people who were really trying to do good critical thinking, like pick your person. I don't know that I would pick Thomas Jefferson, but he's not my favorite founder. People who were really good faith people we're making really big moral mistakes. Very likely we are living through a kind of moral catastrophe right now, but we can't see it. And so the value of critical thinking is to say, like, what is that moral catastrophe that's in our midst right now? And I think that there are some candidates that people are talking about, and then there are some things that we might not even be able to imagine. Now, is critical thinking especially bad now because of the internet? Maybe, but maybe critical thinking is getting better because of the internet. I kind of think, like, how incredible that I have access to so much of human knowledge just like sitting in my office. Like,
right. So I guess it is what you make of it.
I can see so many more arguments than I would have seen before. Like before, people sort of only knew the perspectives of their own place and time. Maybe what looks like it's the critical thinking disaster is just that people are exposed to all of these different arguments and perspectives, and that in the past they weren't. And so, like, yes, there's more conflict, but there's also potentially more progress on the same dimension. I don't know. I didn't.
Yeah, no.
I sort of like took a turn with that answer, but like when you mentioned that they were products of the time, maybe we're living through a moral catastrophe. There's a nice paper about moral catastrophe that I think like, does illustrate the value of maybe both critical thinking and a sort of epistemic like humility, like a sort of like maybe we're also really getting it wrong in this way.
Yeah, maybe we'll do a whole other show on the founders together and Thomas Jefferson.
I'm not an intellectual historian.
That's just really interesting to me, and obviously we don't have to end this in perfect agreement on that, but I think it's interesting because to me, Thomas Jefferson, everything I've ever written, his thinking was perfectly clear. It doesn't mean that the person that he was not flawed, and by 2017 standards, we know he was having sex with a slave, which in effect is rape because he had the power over her. So I get it. And yet, at the same time, as I said, was writing the laws to free them, was doing so much goodness for people to own their lives and be individuals and have the country that we have right now. And I just think it's, so that's why I love him.
But there were also like abolitionists, at the time and throughout history who were getting it right. And so, I mean, I think one thing that when we think about...
I think he was trying to nurture the system through a horrible phase, basically. You know what I mean? Like, yes, there were abolitionists that were more openly abolitionist than he was as he was part of the government, but he was also trying to not destroy everything at once because there was a lot of goodness in the system too.
Yeah, I did not expect this to take. This took a real turn outside my wheelhouse more. But,
but in effect, critical thinking. It's maybe there's an internet piece of it that makes it sort of better and worse at the same time.
Yeah, I think that one thing that sometimes happens in these sorts of debates is a sort of like relativism where people become like very suspicious about like thinking about moral truth or like there being a moral truth and think like, oh, well, true for the time or true for that place or true for that person. And then there's like this sort of like second step where people are like, so like who's to say? Like, like we'll just have a sort of like, we should all just be tolerant of everybody else's viewpoints and like we shouldn't like cast judgment on people with whom we disagree in any sense. And I think that's true that you should have a sort of robust tolerance just for people expressing different kinds of viewpoints. But I also think that that doesn't mean that there's not like a right answer. And like there definitely are right answers. They're just really hard for us to know. And like sometimes when people disagree or when people on the internet are like, oh, like being mean to each other, I guess, people think like that sort of cast doubt on like anybody being right about anything if you want to be the person who says that like people shouldn't be mean. But like, nope, like I think that there's like a truth about like the right and wrong answer about these questions, about moral questions and political questions, about justice, about what we should do. But that part of that right answer is that we should have more tolerance, that we should be tolerant of different viewpoints. But that's something that's a moral claim too. Like we shouldn't have like a kind of, I think we should resist a move to relativism from the view that like we should be respectful of disagreement.
Yeah, I am completely
those
with
two
you.
things are different.
Listen, I'm completely with you on that, and I'm always for more tolerance in the truest sense of what tolerance is, not fake tolerance that we often see these days. I think we should, since you're already co-authoring a book where you're taking one side and another side, we'll do the co-authored Thomas Jefferson book. There you go. I'm just planting the seed. It's been a pleasure chatting with you. And for more on Jessica, follow her on Twitter. It's @MissJessica. That's a great. How do you get that Twitter handle? That's a good one. And check out her book, Pharmaceutical Freedom.